Hello everyone, I am Dr. VINAYAK Koparde. I am Child and Adolescent Psychiatrist working in the Department of Pediatric Neurology at KLES Dr. Prabhakar Kore Hospital. Today we are going to see about Attention Deficit Hyperactivity Disorder, which is commonly known as ADHD. Many a times parents complain that their child is hyperactive, does not focus, cannot concentrate in the school, which starts affecting their academics. So when do we call someone having ADHD? They should have at least few symptoms from inattention, where they are forgetful in their daily activities, they cannot focus or concentrate in the studies, it's affecting their writing, that they have become slow in their writing, or they cannot have patience to wait at something. Similarly, they can have hyperactive behavior in which they are seen as someone who is very talkative, cannot sit quietly at one place, being fidgety and always moving their hands and feet, and is risk taking. So the impulsive behaviors can affect as if they are impatient, cannot control their anger, they may lash out, hit, push someone, or would not think twice before doing something. So the ADHD will have three types of symptoms, that is inattention, hyperactivity and impulsivity. It is a very common disorder, what we call it as a neurodevelopmental condition. At least 3 to 5% of the children will have this, more commonly seen in boys compared to girls. Girls will have mostly inattention symptoms and less of hyperactivity. Once it starts affecting their school life, that there are a lot of concerns from the classroom, that they are not concentrating, they are leaving their seat, they are disturbing other children, they are unable to complete their classwork, and they are having a lot of behavioral issues in the classroom. That is one indication. The next is when children are difficult to adjust in the neighborhood or with kids, or at home getting into dangerous or risky behaviors. That is the time we need to come across and see that it is a problem. What to do about ADHD? First of all, consulting an expert, whether a psychiatrist or a psychologist or a pediatrician, about the concerns is very important. The psychiatrist or the psychologist will run through some assessments to find out what are the problems related to concentration, what are the problems in the school, how is the child doing academically. Some tests may be required, such as hemoglobin, when it is low, can present with lack of concentration. Similarly, children who are having epilepsy or seizures may need evaluations. What can we do when we find that child has ADHD? Child will need good amount of support from the family, in the classroom, and from the professionals. In the family, child will need good amount of physical activity, at least 45 minutes to 1 hour of sports or outdoor activities will help reduce hyperactivity. Reducing sugar content, excess sugar content in the food will help to reduce hyperactivity. Similarly, parents trained to communicate with the child in a proper way, using rewards to improve their behaviors will help. The second aspect is about classroom management, where child is helped by sitting in the front, giving responsibilities in the classroom, praising a lot of good behaviors and involving in overall caretaking of the class will definitely help. Children who have moderate to severe ADHD will be helped by use of medication along with other interventions what we mentioned. The medicines which are used are safe, are tolerable, and mostly given on the school days to improve their concentration. Overall, you should remember that ADHD is a common condition, usually mislabeled, and some of the famous personalities also had ADHD, but when the energy is channelized in the right way and direction, it can help grow the child into a useful human being. Thank you.
ಧ್ವನಿ ಧ್ವನಿ ಇದು ನಮ್ಮ ಧ್ವನಿ KLE ಕನಸು ನನಸದ ವೇಣುಧ್ವನಿ.